So Dr. Solomon, I understand this is your new clinic, a new location for you. What made you decide to make this move?
Well, we established this clinic for facial and nasal reconstructive surgery. The whole process of having surgeries is a big process for many patients, and I think having a nice, warm environment for them to come visit and see their doctor is important. As well, the extra space has allowed us to expand our services to include laser rejuvenation procedures, as well as more space for fillers and other skin care treatments, which go hand in hand with the surgery that I do.
Well, terrific. I think we're going to go take a look at some of those procedures right now.
Great, thank you.
Marion has now finished her skin rejuvenation and has come down to see Dr. Solomon for some fillers and Botox. So let's talk to Dr. Solomon and find out exactly what type of filler he's going to be using.
So Marion's looking to rejuvenate different areas of her face. Firstly, her forehead area where she has some vertical lines, and then her midface here where she's got what's called nasolabial lines, and around her lips she has some lines consistent with aging. Forehead, and we're going to place Botox right around them to weaken the muscles that are creating those two lines. All right, Marion, so what I want you to do is I want you to really frown for me and show us those lines. That's great, and you're going to feel just a little bit of a prick.
So Marion, please tell me, how did that feel? I'm dying to know.
It's fine. It doesn't hurt. There's nothing to be afraid of. It's just a little pinch and it's over.
So Dr. Solomon, is Botox truly safe? You hear a lot of stories about it.
Well, it is a toxin. I think that's where the stories come from. It's a botulism toxin, but it's been used for medical purposes for many, many years and is deemed to be very, very safe. Currently, I think it's been used for millions of patients worldwide.
Okay. Well, I understand now that you want to do a filler in conjunction with the Botox. What would that be?
So we're planning on using a temporary filler called Juvederm, which is a product which is totally safe, has no risk of allergy, which some of the other products do, and lasts roughly between 6 and 12 months. We're going to start here on this fold, and we're placing the filler here. So we're just placing the filler now. You're doing great. Feel a little bit of pressure and slight discomfort.
So does that feel different, Marion, than the Botox?
Very similar. You just feel the pinch.
So Dr. Solomon, can these fillers and Botox be used to replace surgical procedures?
In some cases they can. It's usually not to replace surgery, but in conjunction with surgery or in patients that aren't quite ready to undergo a major surgical procedure.
Well, Marion, that was very brave of you. And how do you feel? You've looked in the mirror. How do you feel about the results?
Great. I'm thrilled. It's wonderful. It's easy to do. It's no hospital stay.
Would you do it again?
Definitely. And the best part is you can just get up out of the chair and go home.